Okay, I made this a part 3. I probably could have added this section with the opioids, but it's better for my computer to break these up. And maybe for watching them, it breaks them up. But what I'm getting into now is the rest of the drugs that we have for pain relief in animals. And a big category we use are called NSAIDs, non-steroidal anti-inflammatories. Aspirin, which we don't typically use, we don't like to use in dogs, is considered an NSAID. Acetaminophen is another thing we don't typically like to use in dogs, and that is Tylenol. But they are listed on here because they are in that category. Let me go over the common ones. These are all the different names. Carprofen is Rimadyl, is probably the number one NSAID we use. Meloxicam is called Medicam. And Medicam is a liquid. So carprofen, you can get it in injectable and tablet and chewable. Meloxicam is a Medicam, and that is a liquid. It is very good for exotics, and you can use it for small dogs. For big dogs, you can use it. The problem is you have to use a lot. So the advantage to meloxicam is to use on the smaller patients. We also use ketoprofen, which is ketofen, and that's not as common, but is used. The other one on here, this ribonoxicib, is actually the Onsior, and this is one of the first ones to be used in cats. Onsior is Onsior. We have it in the kennel. You guys will use it post-op for the cats after stays and dentals. And again, that is Onsior. Let me mention Onsior is unique in cats. So for a long time, cats can't process NSAIDs like dogs. So forever, this category was only used in dogs and some large animals. Then they finally came out with Onsior for cats, and there's 3 tablets. You give 1 tablet, or you can give 1 tablet every 24 hours for 3 days. But after you give it for 3 days, you have to wait 2 to 5 days before you can give it again for 3 days. Now, most NSAIDs like Duramax and Rimadyl, dogs will get them once or twice a day they can be on these for months, years. And they can get it every day. They don't have to take those breaks in between. So cats are very unique in this that, we don't normally use this category in cats. But if you're going to pick one to use in a cat, Onsior, which is very new. In fact, I've barely used it. It's that new, is one of the ones that we can use. And then Duraxicib is Duramax, which is Deramaxx. I'd say the 2 most common that we use post-op for post-op pain, arthritis issues is going to be Carprofen, which is Rimadyl, and Duraxicib, which is Duramax. Now, it says some come by injection, but the most common way we use these drugs is orally. Now, you can use them post-operatively. Very rarely do we give them pre-operatively. Most of the time, these drugs are saved for post-op use. This is not a preemptive analgesia drug, and I'm going to explain why. So how do they work? Okay, let me make sure. They are good for somatic and visceral pain. When they are given orally, they are typically given, get in about 30, 60 minutes. And again, depending on the dose you give or the species, most of these are once a day. So normally the dose we use is an every 24-hour dose, but you can adjust the dose and give it twice a day. And that's a doctor preference. Again, this is something the doctor usually tells me how much they want to give and how often they want to give it. This isn't one that, I usually guess. It does have analgesic properties, but the way that they work is they typically inhibit inflammation. Most of our pain after surgery, arthritis, cancer, causes inflammation. And that basically is what these drugs will inhibit. Now, a little inflammation initially is needed for healing, but we don't want inflammation to persist. So what we're trying to do is minimize the inflammation. But one thing that I want to mention is they are metabolized in the liver and they are eliminated by the kidneys and then through the feces. But prior to using these drugs, you need to know liver and kidney values, because on these drugs, we monitor liver and kidney because they can cause liver and kidney damage. So you don't want to give these to an animal that has liver or kidney dysfunction, because we're going to potentially make that worse. So we always are going to start with blood work and evaluate those enzymes, deciding, do we want to give them? Now, the problem is NSAIDs prevent so prostaglandins, if you remember, are tissue hormones, and they initiate a lot of the initial inflammation. So these drugs prevent the production and the release of prostaglandins. But like I told you, sometimes we're preventing something that's maybe bad, but we're also preventing beneficial prostaglandins. Beneficial prostaglandins protect the GI tract. Beneficial prostaglandins help maintain blood pressure. So there are good things that prostaglandins do, but when you use these drugs, you're basically going to stop both of this. What they do is they inhibit the COX-2 enzyme, which you studied all of this in pharmacology, but they tend to not inhibit the COX-1. The older NSAIDs inhibited COX-1, but COX-1 has beneficial effects. These later drugs are more COX-2 selective. So what happens is they minimize the COX-2, but they will allow COX-1 beneficials to continue. But I will tell you, they constantly are trying to adjust these drugs to find the perfect balance where you keep the benefits of the COX enzymes, but you prevent the inflammation. But so far, they've not been able to do that. They get close. But if you want to review that, it is in your pharmacology notes. I told you in my email, there's key things that I want to tell you that are client education topics. When you send home these drugs, which go home with so many patients, what you need to do is warn them of this very first line that you need to highlight. They can cause stomach ulcers, which can cause vomiting. And if you have any ulcers or severe vomiting, you can get GI bleeding. And then when their stomach hurts, they don't eat. The GI ulceration can lead to severe hemorrhage or septic abdomens. So what I always tell owners when they use these drugs, I'm like, if there's any drooling, if there's any not eating, if there's any vomiting, if there's any diarrhea, you need to stop this medication. Because again, like it's kind of like in people. I take Advil for headaches, aches. I can take Advil like it's candy. It causes no issues. My sister, super sensitive to Advil. It upsets her stomach. Okay? So some animals are going to be sensitive to these drugs, and some of them are going to take them with no problem. But an owner needs to know that these can cause some serious issues. So they need to call us if they see any of that. And again, some dogs that aren't eating, it's because they're having the stomach upset. They're not vomiting and they don't have diarrhea. They just don't feel like eating because this is upsetting their stomach. We can use other pain meds, so it's not the end of the world if we can't give these drugs. Now, renal toxicity. There are reports of dogs being eaten as drugs, and they could push them into renal failure. So I'm going to tell you something really important right now. When we wanted to give these drugs to patients in oncology, they came in and they got initial blood work. If the liver and kidney values were normal, we would send home a 2-week supply, okay? In 2 weeks, they came back in for repeat blood work. And owners were like, well, you just did blood work 2 weeks ago. Why do you want to do it again? Do you want my money? Blah, blah, blah. No. The reason we want to recheck it is because if they are going to cause liver or kidney problems, you're going to see it in those 2 weeks. So, for example, if I give it to a dog and in 2 weeks, the blood work looks equally as normal, I would give them a 6-month refill authorization. So that means they can have that drug for 6 more months, and then we would repeat blood work every 6 months. Because normally, if they can tolerate the first 2 weeks, they will tolerate 6 months. Is that 100%? No. But on average, most patients, if they tolerate the initial trial, they're going to tolerate. So most of our cancer patients, they need to be on chronic pain medication. So I was refilling these drugs. I mean, a lot. A lot of dogs that are that have arthritis or hip dysplasia, they're on these drugs for life. As long as the liver and kidney can handle that, then they would go ahead and keep giving these. Okay, had to pause a second. The other thing that we worry about when we use NSAIDs, besides the renal toxicity, and we have to talk about the liver damage, is that the platelet aggregation can be impaired. And what that means is it affects platelets' ability to stick together. That's the blood's ability to clot. So if we have a patient come in for surgery and they've been on an NSAID for a week or more, sometimes the doctor will have them stop those before surgery because we want their blood to have the ability to clot. So it can, lead to prolonged bleeding, oozing from incisions. So we have to be cautious about that. So the big thing here, these are important client considerations. And my big thing is you have to have blood work prior to starting. If you have a client, and some clients are very money conscious and they say they don't want blood work, we will usually have them sign what's called an AMA, which means against medical advice. And that means they sign a paper that says, we've informed you of the risks. You choose to not do the blood work, but we are not responsible for what will happen if we, AJ, stop it. Okay, now, other analgesics, the two that I just talked about, opioids and NSAIDs, are the two most common that we use. Opioids are used pre, intra, post-op, sent home. NSAIDs are typically used post-operatively and sent home. So let's talk about some other categories now. Local analgesics or local anesthetics, I talked about in the Chapter 7 lecture. So I've already gone over that and the advantages. Alpha-2 agonists, the advantages, remember when I said dextromethorphan and xylazine, they are the one pre-med besides opioids that do have analgesic effects. The reason we give them is because they're sedatives. So that's the primary reason, but they do enhance analgesia. So normally we use them in a pre-med, but some people will use them in large animal. Some people will use them in CRIs, and they will use, now when we use them post-op for pain, we are giving them in low doses. We're not doing sedative doses. When we use them as pre-meds, we use sedative doses. So post-op dosing is going to always be different than usually your pre-op. And you can give them in the epidural space. Now, since we've already covered the side effects, I'm not, bradycardia, we see bradycardia, we see sedation, but they're used a lot in horses, xylazine, and when I do horses, I'll talk about dotomidine and romifidine because I didn't talk about those when we did pre-meds. But the one thing to be cautious is usually when we use these in horses, we want them standing If you give too much, they can cause ataxia, but they are good for these moderately to severely painful procedures. But again, remember, alpha 2s are reversible. If you use an alpha 2 and you reverse it, you take away the side effects, but you take away the analgesia. So usually you have to make sure there's another analgesic on board before you reverse these, or your animal will be painful. Ketamine. I talked about ketamine when we did induction agents. Ketamine is an anesthetic that is used for induction. You can use it for sedation, like if you want to knock down a cat to groom it. But most of the time, ketamine is mixed with Valium and given IV to intubate. But it can be used as part of like a pain protocol. So a lot of times ketamine's added to enhance MLK. Ketamine enhances the analgesia. It blocks the NMDA receptors in the spinal cord, so it helps with wind up. But remember, when we use ketamine post-op in a CRI, we are not using anesthetic level ketamine. We are using very low dosing. And actually in people, they are using ketamine as a nasal spray to treat depression. So ketamine has like all these other things that we can do with it. But I want you to know, when it's post-op, it's in lower dosing. And you remember the effects of ketamine. Now, I talked about the tachycardia, hypertension, sometimes salivation. But when these side effects are seen typically at anesthetic level dosing, not analgesic level dosing. So we don't tend to see this when we do an MLK CRI. Of course, we always watch our patient, but you're not going to see these as often. Now, the next two drugs I'm going to talk about are typically sent home with the owner. And these are used a ton, so I want to spend a bit of time. If you've heard of tramadol, it's called Ultram in people. So people get tramadol, dogs get tramadol. It is a morphine type drug, an opioid derivative. Has some activity at the mu receptor, inhibits reuptake of norepinephrine. It is typically used after 24 hours after surgery because it's an oral med. So let me explain. Dog wakes up from surgery at BCA. They're usually kept on an MLK CRI overnight. And then usually in the morning, we try to take off the IV and we start giving them their oral drugs. A lot of times tramadol can be given with Rimadyl. So a lot of patients will get Rimadyl orally and tramadol orally. They do not interact. So they are safe to give together. The nice thing is this is an alternative that can be sent home that's not an opioid. It is considered, it's technically a Schedule 5. People are talking about it moving to a Schedule 4. So sorry, this is a Schedule 5. Drug schedules change. So when we do tramadol, when we fill it at the hospital, we have to count it, record it. And then we'll usually give, now how much we give. The nice thing about tramadol, it can be given up to 4 times a day or only twice a day. I usually put on the label, my doctors will say give every 8 to 12 hours as needed for pain. Now, people are very cognizant of not overusing pain meds. I've had owners say, I don't want my dog to be on pills. And because you don't want to become dependent on drugs. Well, we don't have that in animals. Sometimes I had to talk owners into taking home tramadol. I'm like, your dog's going to benefit. Your dog's not going to become addicted. I can't force them, but I'm like, this is why you should use it. But one thing you have to be cautious of is bogus refills. Some people were put on tramadol and they abuse it and they try to get it through their pet. We had an oncology client and the dog had a pretty severe form of cancer, and we sent home tramadol, and we kind of predicted in like 2 months that this dog probably was going to pass. It had been 6 months, and this owner calls and says, oh, yeah, Fluffy needs some tramadol. And first of all, we're like, Fluffy's alive? We have not heard from these people for 6 months. Secondly, we started to ask questions. She was very vague. And my boss was like, well, we need to do a recheck. We need to see Fluffy before we can refill this medication because we got a bad vibe. All of a sudden she goes, oh, I'll check my calendar. I'll call you back. Never heard from her. Called the 2 previous clinics the clinic that referred her and another clinic, they both had gotten phone calls for refills and denied her. So our assumption was this client was trying to refill, saying it was her dog, because she didn't even go to her vet. She wouldn't go to any of us to bring the dog. So doctors, we used to send home a lot of tramadol, but now that it's been controlled, we'll send home small doses, 2 or 3 weeks worth, and then they have to come back for refills. And the reason we do that, well, first of all, we want to check the pet, but we want to make sure that we're prescribing it for the right reason. Now, I want to make a comment about tranquilizers. Sometimes an animal wakes up bad after anesthesia, and sometimes we want to give it morphine or something. But sometimes we'll add a little ACE or some midazolam to that. We'll add a tranquilizer. The reason we're doing that is to enhance the opioid. ACE promazine is not an analgesic. They will look sleepy, but that doesn't mean they're pain-free. Midazolam will cause some sedation. Doesn't mean they're pain-free. So you should never give a dog ACE because you think they're painful instead of an opioid, but you can use them together. But I will say tranquilizers do not, besides alpha-2s, none of the other tranquilizers I taught you have analgesic effects. A drug that's gaining popularity, it is used a lot in people. We used a lot on the neurology service at VCA, is gabapentin. And gabapentin is used for people, and it's used for something called neuropathic pain. So this is pain that we feel like is coming from the nervous system. Now, all pain response comes from the nervous system. What I mean is sometimes nerves are overfiring, or sometimes we're giving Rimadyl and Tramadol and we're just not reaching this patient's pain level. We'll add gabapentin. I will say most hip surgeries, knee surgeries, a lot of our cancer patients went home on Rimadyl, Tramadol, gabapentin. And you might think we're over-medicating this dog, but do you remember multimodal therapy? We are trying to treat the pain at 3 different receptors. I would rather give my dog 3 pills. They don't interact with each other. But if I can give 3 different ways to treat pain, my patient's going to feel better. By definition, gabapentin is an anticonvulsant, but it treats patients that are hypersensitive to pain or have neuropathic pain. And basically, if you remember, GABA is a neurotransmitter that has basically a calm. It doesn't stimulate the nervous system, it calms it down. Gabapentin is similar to natural GABA, which has a nerve calming effect. So it is particularly good. Say you have a dog that's getting tramadol and an NSAID, and they're not responding. We might stop the tramadol and add gabapentin. We might just add gabapentin. It is an oral capsule. It comes in 100 and 300 milligram strength. If you have to use it in a cat or a very small dog, you have to get it compounded because the syrup form of this drug, the liquid form of this drug, has xylitol in it, if like you bought it from a company. And dogs can't have xylitol. So what we'll do is we call a compounding pharmacy, and we can we can get the capsules made into a liquid so you can give it to cats. Now, cats usually only get gabapentin once a day, once every couple of days. It's more profound in cats. Dogs can get gabapentin up to 4 times a day. Once a day, twice a day. But I will tell you, GABA, from a personal perspective, GABA is the type of drug you have to continually give it for it to work. It takes a couple days for it to kick in. So gabapentin isn't like, I have a super painful dog, I'm going to give it GABA, it's going to feel better. It's going to build, but you mean you have to continue to give it. So it's not like I give a dose and I wait 2 days. It doesn't work that way. You have to give it. So I always tell owners, make sure you give it. The only thing I warn owners about is drowsiness. And I didn't mention that about tramadol, and I'm sorry. Tramadol and gabapentin, the major side effect that I tell owners is if they are sedate or ataxic. It should not make them. Now, I will say a dog on tramadol or GABA can be slower. They're not going to be as energetic. But the sedation, it shouldn't cause sedation. And NSAIDs cause no sedation. I always have students tell me, I say, what do you look for with NSAIDs? And they say sedation or drowsiness. NSAIDs cause none of that. But if you use GABA and tramadol, they can cause sedation. And I tell the owners to call us because we can adjust the dose. They shouldn't be ataxic. They shouldn't be overly drowsy. They should be able to eat, drink, walk like normal. And if they can't, then they're probably potentially getting too much. I'm going to skip amantadine. It's a very newer drug, but I'm going to skip that one for now. I want to talk about corticosteroids. And there's sometimes key things that I'm like, please remember this when you graduate. Please remember this for your board exam. A corticosteroid does basically the same thing a non-steroidal does, except it's a stronger anti-inflammatory. This is prednisone. This is dexamethasone. Zone, S-O-N-E. These drugs are used for inflammation, but most of the time we use steroids in emergency, in really bad skin allergies. We don't usually use steroids for pain. We prefer to use opioids. We prefer to use NSAIDs because they have less side effects. Corticosteroids have some pretty severe side effects: stomach ulceration, immunosuppression, hyperadrenocorticism. So the big thing and the huge thing is you cannot give an NSAID and a steroid together. You cannot. You pick one or the other. So if you have a dog that's on Rimadyl, and if the doctor wants to switch to a steroid like prednisone, you have to do that washout period. We talked about it in pharmacology. You have to wait 5 days in between. So you would stop the Rimadyl, wait 5 days, and then start the steroid. If you give them together, you have a very high likelihood of stomach ulceration, stomach hemorrhage, potentially ulcers that rupture would be the most severe case. Okay, so you cannot give these with an NSAID. You're going to pick one or the other. Most of the time it's going to be NSAIDs. But these are anti-inflammatory, so they will give pain relief because they minimize inflammation. But the problem is, between the ulcers and the effects on the liver and kidney, long-term steroid use is not recommended in patients. So the nuts and bolts of everything I talked about is we want to use a combination of drugs. Multimodal therapy is the whole thing I've been preaching. So what are examples? I've talked about it. There are reports of people using acetaminophen codeine. I want you to forget about that. That's not more common. Fentanyl and meloxicam. Now it says you can give this to cats. There are reports of people using Metacam in cats, although most people don't do it. Most people use, but you could do fentanyl Onsior. We could do morphine and carprofen. Do you see how I'm using an analgesic and an NSAID? MLK, opioid, dissociative anesthetic, local anesthetic, multimodal, post-op, tramadol and gabapentin. Those are all examples of multimodal analgesia. And then for home, these are the ones that are commonly used. Fentanyl patches can be used. Now, I don't know if I mentioned this. A fentanyl patch lasts 72 hours. If I put a patch on a dog on Monday morning, remember 12 to 24 hours to kick in. That patch is effective Tuesday, Wednesday. The end of Thursday is about when it loses its effectiveness. The animal can come in and get a new patch. NSAIDs, take home. I've never used oral morphine tablets. Most clinics don't carry it due to the high risk, but you could use oral butorphanol, remember? Butorphanol tablets, tramadol, gabapentin. Those are all good home techniques. Now, the last thing to talk about is nursing care. If an animal is painful, obviously we're going to use drugs, but there's ways that we can keep the animal comfortable. Cages clean and dry, nice bedding, pillow. At VCA, we've got yoga mats, we've got pillows, we've got mattresses, because we deal with a lot of down dogs and we need good bedding. We need a lot of good padding. The other thing, I'm guilty sometimes of neglecting this. Does the patient need to urinate and defecate? There was a dog one night that was crying, and we're like, oh my God, is it painful? We've given it meds, it keeps crying, blah, blah, blah. Finally, someone was like, let's take it outside. That dog peed like a lake. And then when it came in, it laid down, it went to sleep. A lot of dogs are trained to not go in their cage. So this dog was very anxious. We were initially, and I will admit it, my mind was on pain, and I was thinking this dog was crying because it was painful. It just had to go potty. So an animal will start to get anxious and cry if they got to go to the bathroom. So are they peeing? Make sure they're not laying in their urine. Make sure they're laying in a comfortable position. Now, toys and blankets from home can help, although I will tell you, a lot of clinics, VCA is a big hospital, and we worry about losing bedding. My dogs just stayed there when I was on vacation, and I sent a really nice blanket. Initially, they were at somebody's house, and then they brought them to work. I did not want them to use that blanket because they could have lost them. We lose a lot of bedding. So a lot of times we do not accept bedding and toys from home just because we don't want it to get lost in the laundry. We had an owner for a radiation patient brought a really nice dog bed, and I had it in the kitchen. And when we went to send the dog home, we couldn't find the bed. We think one of the employees took the dog bed. We didn't have proof, but it wasn't destroyed in the laundry and I couldn't find it. So you have to be careful. Make sure their eyes, sometimes patients on these drugs, their eyes are semi-open and can be dry, which causes pain. So put eye ointment in and then talk. You can pet them, talk to them, try and reassure them. There's also massage therapy, heat and cold packs. There's laser therapy. Some people get into acupuncture. We have a few. There is a clinic in Indy. I think it's Pet Pals or Pet Paw Place. She practices some Eastern medicine. And then there is homeopathic. We have to be careful with some of this. So I will tell you, basically, we are willing to try a lot of different things to achieve pain management. So be familiar with the home indications I talked about and such.